The next topic, as I've mentioned, is basically to assess the impact of daily oral PrEP on maternal mineral bone density within the IMPAACT 2009 study, and then I'm the author on this paper. So, just to mention that there was no conflict of interest, and just some background. So again, as we all know, daily oral PrEP is an effective, safe, HIV prevention strategy that has been used among pregnant women as well as postpartum women. Daily oral PrEP is as per TDF and FTC as we know it, and there has been a pharmacokinetic study that was part of component 1 of this study that was published in 2021 by Linda. And then just to also mention, as previously, there was no safety concerns or pregnancy outcomes that was concerning in the maternal data as presented by Benchy in 2024 at CROI. We do also all know that physiological changes do happen during pregnancy and breastfeeding that could exacerbate bone mineral loss, and this is irrespective of oral tenofovir and FTC. In this study, we compared the bone mineral density amongst pregnant patients who initiated PrEP and also who declined PrEP and those that changed during pregnancy and postpartum. So study design. The study was a study where we looked at HIV-negative women, which we actually determined at the screening visit amongst the 4 African countries, Uganda, Zimbabwe, Malawi, and South Africa. They were eligible if they were between 16 and 24 years of age, and it was a parallel observational cohort study, which we wanted to look at PrEP adherence as well as safety amongst pregnant and postpartum women. Participants, as we've mentioned before, opted into PrEP as cohort 1 or opted out of PrEP as cohort 2, but had the option to change in between. So exposure, as we've mentioned, was most likely assessed for those that were either enrolled at the beginning and exposed to PrEP or that got exposed to PrEP before birth. Mothers and infant pairs completed follow-up through 26 weeks of the study and postpartum. If we look at the analytical plan for the methods for the bone mineral density, apologies. There we go. So the bone mineral density was taken of the lumbar spine as well as the hip, and that was assessed using dual energy X-ray absorptometry, which is the DEXA scan at delivery as well as week 26. So here we have a comparator because we did the hip as well as the lumbar spine at both time points. PrEP exposed, as mentioned previously, was defined as a person that was on PrEP at enrollment or before giving birth. Eligibility for the analysis were maternal participants who had a DEXA scan within the analytical window. So any DEXA scan, whether it was a hip or a lumbar, was used for the analysis of this. Okay, differences in mean maternal bone mineral density between the antepartum, PrEP exposed and unexposed at delivery as well as week 26 were evaluated using the t-testing assumption, unequal variance. Differences in mean amongst the PrEP exposed and unexposed were also determined, as well as 95% confidence intervals were calculated. Okay, so between May 2022 and December 2022, 350 people were enrolled, 233 in the PrEP exposed, 117 in the PrEP unexposed, of whom 310 were retained through to week 26. So one of the main reasons, unfortunately, why patients left was because lost to follow-up, and this was during, prior to the delivery as well as after the delivery. If we look at some of the maternal demographics, we can see here that most and majority of the participants were enrolled from Zimbabwe. The mean age was 21 years of age. The mean duration on PrEP was 11.45 weeks. And also, majority of our patients actually opted to breastfeed at about 96%. If we look at the bone mineral density box plot here on your right, then you can see that there wasn't a very big difference between, firstly, delivery and week 26 amongst the PrEP exposed as well as the PrEP unexposed. So, DEXA scan availability for either a hip or spine scan at delivery amongst the PrEP exposed was 171 at 73%, and PrEP unexposed was 86 at 74%. At week 26, we had 166 at 71%, and again 86 at 74 amongst the PrEP unexposed. If we looked at some of the data tabulated here, we did take the delivery mean and postpartum mean for hip bone mineral density. As you can see, the mean was 0.02 for the delivery and 0.01 for the week 26, so very similar. And then across the spine as well for delivery at 0.02 and for the postpartum at 0.01. So not a lot of difference was seen amongst the analysis. In conclusion, no difference in the mean of maternal bone mineral density was observed at delivery and postpartum week 26 by PrEP exposure. Combining this with other maternal safety data as well as the infant safety data, which I just presented, the finding often supports that TDF and FTC by pregnant and postpartum women can be used as an effective prevention for HIV. Additional analysis is, however, underway, where we are looking at the association between breastfeeding. We are looking at FEMA-NEC, as this has been also shown to show better and accurate results, and also amongst other concomitant drugs, for example, contraception, which we also all know has an effect. However, these findings are reassuring and support the continued use of TDF and FTC as PrEP in pregnancy and postpartum. Again, just a very big thank you to the protocol team for trusting me to do this abstract and presentation, to the protocol chairs who has supported me, Ben Chi as well as Nina Stranix, to the IMPAACT network for allowing me to be able to come and publish this data, to the sites for their rigorous clinical trial data and method collection, Malawi, Zimbabwe, Uganda, and South Africa, and to above all, to our study participants who trusted us with their information, and just to thank also that the study product was supplied by Gilead.